In this video, I'm going to share 6 stretches that can be done to help with low back pain or stiffness. If you were to ask me what is the one single stretch that could help low back pain, unfortunately I wouldn't have an answer for you for that one. And the reason is because there's a number of different structures in the low back that could be responsible for actually causing the back pain. Now they found that the intervertebral disc, the facet joints, the muscles, the ligaments, the nerves could all be pain generators in a painful low back, and each one of those would require a slightly different method of treatment. There's a concept that I want you to think about, and it's called the joint by joint approach. Now what the joint by joint approach says is that the body is simply just a stack of joints, one on top of each other, but it's arranged in a pattern of stable and mobile joints. So if you look at the image, you can see from the bottom, the foot is considered to be a stable joint, the ankle is considered to be mobile, the knee is stable, the hip is mobile, the lower back or the lumbar spine is stable, thoracic spine is mobile, and you can see that pattern goes all the way up towards the cervical spine or the neck. So generally what happens if there's a disruption in that pattern, that's when we start to see pain or injuries occurring. So for example, what's quite relevant to low back pain, look at the 2 areas above and below the lumbar spine. That is the hip below and the thoracic spine above. Now they are both mobile areas or mobile joints. If those areas were to lose mobility, so through injuries, through postural dysfunction, through occupational factors, what's going to happen now is that the stable lumbar spine area is going to now end up compensating and giving up some of that stability to compensate for a lack of mobility in the hips or thoracic spine. And whenever the lower back gives up stability, that's when we land up with essentially an unstable lumbar spine, and that can lead to pain in the lower back. What it can also do is lead to compensatory muscle stiffness. So what the body sometimes does is then recruits the postural stabilizers. So some of the big ones are the paraspinal muscles that run up the lower back. What it does is recruits those to try and create extra stability in the lower back. And that's what gives people that perception of constantly tight or stiff or achy lower back. They might think they need to improve their low back mobility, when in actual fact that is just a compensation. The actual cause or the root problem is a lack of mobility in the thoracic spine and the hips, and that's then causing the low back to compensate, and that's ultimately what's causing the pain or stiffness. So to help with the low back pain or stiffness, we want to look at the mobile areas above and below and maintain that mobility there. These stretches that I'll be sharing, they're a combination of traditional static stretches where you would simply get into position and hold a stretch for 15 seconds up to a minute. There's dynamic stretches, which involves repetitively taking a muscle or a joint through a full range of motion repetitively. And the third kind of stretch is a contract relax stretch. That's a type of PNF stretching, which is short for proprioceptive neurofacilitation. So essentially what we do there is the muscle that's being stretched, we put it on a gentle stretch, contract for 5 to 10 seconds, and then relax, and then take that stretch a bit further, and we repeat that cycle a few times. But I'll explain that when we get into one of those stretches. Now it's important while doing these stretches that you don't feel any pain while doing them. A slight sensation or a slight stretch sensation is okay, but a sharp pain is not good. Now it's not one of those situations where no pain, no gain is the answer. It's certainly not with stretches. You want to just hold the stretch. If it's a static stretch or if it's a dynamic stretch, just gently take it through that range of motion, but without experiencing any pain. All right, so with that out the way, let's get into the stretches. This stretch is called the cat-camel stretch, and it's a dynamic stretch because you're not holding it in one position. Instead, what you're doing is taking the spine through a full range of motion through flexion and extension, but without gravity acting on it. So this is a pretty useful stretch to do first thing in the morning, or any time that you have acute flare-ups of back pain. Get onto all fours, and what you're going to do, you're going to let your belly button sink down towards the ground so the low back extends. And then you're going to contract your abdominals so that the low back flexes, and let it extend and flex again. So it's a nice easy stretch, and again you shouldn't feel any pain while doing it. And what this is doing is just mobilizing all the joints and tissues in the low back. Now I'd recommend doing about 1 to 2 minutes of this 2 to 3 times a day, or whenever you have a episode of back pain. Next is the double knees to chest. Now this stretch uses the contract relax method, which is a type of PNF stretching. So what you're going to do is, again, find a spot on the floor. You're going to gently pull both knees up towards your chest, and what this does, this causes your pelvis to tilt posteriorly. So I'm just exaggerating the movement. So what that does, it just places those lumbar paraspinal muscles on a bit of a stretch. So gently pull the knees to your chest, hold this for 5 to 10 seconds, and then what you're going to do, then you're going to contract those muscles. So you're going to try and push your hips that way, but your arms are going to keep them in position. So you're going to push just gently, again, 10 or 20% effort. You're going to hold that for 5 to 10 seconds. Then you're going to relax, pull your knees up a little further, hold that for 5 to 10 seconds, contract again, 5 to 10 seconds, and then take the stretch a little further. And you generally would repeat that cycle about 3 times. Now, one thing to take note of when doing the supine knees to chest stretch is if you have an intervertebral disc herniation or bulge, that position could potentially aggravate the disc because you're moving the spine into full flexion. So if you have been diagnosed with a disc disorder, rather give that one a skip. The next stretch is called the prone extension stretch. Now, this is a pretty useful stretch if your back pain is potentially being caused by the intervertebral disc, or there's a discogenic pain component to your back pain. So the way you do it, again, find a spot on the floor. What you're going to do, if your back is pretty painful and sensitive, what you're going to do, you're just going to start off by pressing onto your elbows and down. And just repeat that motion. If you're fine with that, then you can take it a little bit further and you can press up and down. And you would repeat this about 10 to 15 times. And you would do it every 2 to 3 hours throughout the day, or when you have a flare-up of back pain. Now, something to take note of when doing the prone extensions is if you have a irritable facet joint, so that's the joint in your lumbar spine, that position's probably going to be quite uncomfortable. Likewise, if you have a stenotic spine, or you've been diagnosed with lumbar spine stenosis, stenotic spines do not like moving into extension. You'll find that position is really uncomfortable. So if you have a stenotic spine, you want to avoid that stretch. So the next one is called an open book stretch, and this is a dynamic stretch that works on mobility in the thoracic spine. So to do that, grab a spot on the floor, grab a cushion. You're going to tuck your knees up towards your chest, and then you're going to just rotate over like that. And you're going to repeat that 10 or 15 times both sides. So from the other side, it looks like this, knees flexed. So what that does, that locks the lumbar spine in place. So you're not rotating the lumbar spine, you're causing all the rotation to happen in the thoracic spine. And just exhale as you rotate. The next stretch focuses on the piriformis muscle and the other short rotators in the hip. Now, if these muscles are always tight, you need to start thinking that there could be a lack of hip stability, and these muscles are actually compensating. They're tightening up to try and create some extra stability at the hip. But if the stretch works for you, great. If they keep tightening up and it keeps coming back, you need to then start thinking of a hip stability program. But in any case, here's the stretch. You're going to lie on your back. If we stretch the left leg, you're going to externally rotate it, use the other leg to pull upwards like that. You can hold the shin and just pull up towards you. And you should feel a gentle stretch in the back of this leg. Obviously, you want to repeat that on both sides. And because it's a static stretch, hold it for about 15 to 20 seconds. There's another variation that you can do. Now, not everyone's going to be able to get into this position, especially if you are unable to externally rotate your hips well, or if your anatomy just doesn't allow for it. So the stretch looks like this. You're going to be on the floor. You're going to externally rotate that leg so the shin is flat on the floor, and then you're going to just let your upper body drop down towards the knee. and you're going to just hold it there. And again, you should feel a stretch in the back of that leg. Don't push it, don't force it, just hold that stretch. Again, 10 to 15 seconds, 3 times on both sides. These next stretches are for the hip flexors. So the muscles that make up the hip flexors are the iliopsoas muscle, which is made up of the psoas and the iliacus, and the rectus femoris muscle, which crosses the hip and the knee. So we can get short, tight hip flexors from prolonged sitting, especially those people who work at a desk. And the issue with that is we then lose what's called functional hip extension. So while walking or running, the hip doesn't extend properly, and that changes the biomechanics in the pelvis. And then the way the body compensates is it'll go and recruit the postural muscles, especially in the low back, to try and stabilize the low back, because now the pelvis is moving abnormally, and now it's going to compensate and use those big postural muscles to try and stabilize everything. And that will give people the ongoing sensation of low back tightness or stiffness, where the actual cause is coming from the hip flexors. And that's why this is an important stretch to consider. So to do this iliopsoas muscle, you stretch this leg, you get into a lunge position, and what you're going to do, you're going to just shift your hips forward so that this hip extends. But when you get into this position, make sure that you keep your abdominals and your glutes contracted. If you don't, you end up just extending the lumbar spine and you're not actually stretching that hip. So again, keep the abdominals tight, keep the glutes contracted, and then you're going to just shift forward, and you can accentuate that stretch just by leaning over towards the opposite side, and you should feel it stretching down the front of that hip. Now to stretch the rectus femoris muscle, what you want to do is you want to extend the hip and flex the knee at the same time. So one way you can do that is place a cushion next to a wall, and then what you're going to do is you're going to extend the hip, flex the knee, and then just sit back into the wall. And now you should feel that stretch in the front of the hip and in part of your quads. And again, you're going to just hold that stretch 15 to 20 seconds, 3 times on both sides. Thanks for watching. I hope you found those stretches useful. Again, if you're getting any pain while doing them, stop, get in touch with a healthcare provider or someone that can point you in the right direction, or make a few changes there. Now, you'll notice that I haven't included any hamstring stretches in here, and there's a common misperception that tight hamstrings cause back pain, and they don't. So you can have a look at the blog on our website where we've gone into depth about why tight hamstrings are not responsible for back pain. So therefore, stretching hamstrings will be a pretty useless way to help manage back pain. Thanks very much for watching, and I'll see you again in the next video.